Alright, we're going to talk about Class 1C antiarrhythmic agents. So, 68-year-old male presents to the ER complaining of palpitations. On physical examination, he is cool to touch, diaphoretic, and hypotensive. His EKG demonstrates long runs of supraventricular tachycardia. This is his 6th presentation to the hospital with supraventricular tachycardia in the last month alone. His outpatient cardiologist has tried to control the patient's arrhythmias on many pharmacologic agents, but he continues to revert to symptomatic supraventricular tachycardia. After you stabilize the patient and convert him to normal sinus rhythm, you call his cardiologist to discuss the possibility of placing this patient on a medication that acts by blocking sodium channels in the cardiac myocyte, and that is usually only reserved to treat severe refractory supraventricular tachyarrhythmias. I'll read that again. So you want a sodium a medicine that blocks sodium channels in the cardiac myocyte, and that is usually reserved to treat severe refractory supraventricular tachyarrhythmias. So these are the Class 1C antiarrhythmic agents. So these include flecainide, encainide, and propafenone. So the mechanism of action: they act by binding to sodium channels again and blocking the flow of sodium ions into the cardiac myocyte. By blocking the sodium channels, phase 0 depolarization of the cardiac action potential is prolonged, thereby slowing the rate of conduction of the action potential and thus the rate of cardiac muscle contraction. The class of drugs has no effect on the duration of the action potential. Clinical uses: used to treat supraventricular arrhythmias. Side effects: exacerbation or induction of life-threatening arrhythmias, heart failure, exacerbation. Avoiding patients with depressed ejection fractions. So it says they are use-dependent, meaning that they tend to be more active at ion channels that are depolarizing more frequently. So main points here is that they used to treat supraventricular arrhythmias, and they bind to sodium channels and block the flow of sodium channels into the cardiac myocyte. Thank you very much.